What challenges in the healthcare system do we have now that makes it more difficult for people to lose weight?
What I see is a confusion about prevention versus treatment. So one big obstacle are misunderstanding of obesity. So if you kind of think back to education, we got very little education on nutrition. We had even less education about obesity. And despite it being the most prevalent chronic disease, probably the most important chronic disease, in which leads to all these different chronic diseases that we see that we label as different: heart disease, type 2 diabetes, fatty liver, etc. We got no training on what obesity is, like what's driving it. So we have a lot of assumptions of what it is based on just growing up as kids in society and watching the same movies and hearing the same conversations. So having a medical degree doesn't magically give us insight to obesity, nor kind of understanding it as a real chronic disease. And it's still a very ignored disease despite it being so prevalent. So it's the first thing we see and the last thing we treat.